novel opportunities to optimize cardiovascular risk reduction. Today, you had a very comprehensive few sessions on lipid lowering and various therapies available. So I'm just going to show you some individual cases where we made some good inroads. These are my disclosures. We know heart failure goes from stage A, where there are risk factors, to stage B, where there is structural changes, stage C, where clinical heart failure manifests, and stage D, where it is so challenging that they need to be in the ICU to stabilize them. The only treatment is SGLT antagonist if there is HFpEF. And the cost of SGLT antagonist is still a challenge even in HFpEF because of cost constraints in the United States. So now the question is, can we optimize cardiometabolics and increase myocardial energy efficiency using a positive inotrope, and thereby we can reduce inflammation, which would reduce lipids, reduce blood pressure, reduce risk for cardiovascular readmissions, hospitalizations, and other problems. So this paradigm is what we are using to improve lifestyle and positive psychology. And this is an example where we already realize that any increase in lipoprotein little a significantly increases our risk for cardiovascular events. Other lipids we check every 2 years, 3 years. Lipoprotein little a, we are required to check only once in a lifetime, because until PCSK9 came around, we didn't have any therapies that can alter it. Lifestyle is not effective in improving lipoprotein little a. This is what we are taught. These are my own lipoprotein little a measurements obtained in 2018 summer, and after that I started intuitively cutting down on my food intake personally. So overall my food intake is down by about 50%, and my weight is the same. And what I'm seeing here is my lipoprotein little a has come down from 27 to 19. You may say it's okay in the normal range, but a 30% reduction is not only a pleasant surprise, but in the normal ranges of blood pressure, cholesterol, and insulin and glucose levels, there is still so much benefit that we can accumulate. So this is my LDL, which was 95, that came down to 70 in the same time period of 1.5 years. And my weight was not enormous. It was only BMI of 23, and I weighed only 81 kilos. You may ask, how did that make a difference? So the weight itself is subtle differences may be good enough to create sufficient improvement to reduce risk in low-risk population. So this is what is my own lesson from my experience. And my glucose fasting level was close to 100. Now it is down to 70s. And this is a calculation that we are not routinely doing, but climate change is a real concern globally. And climate anxiety is affecting our children more than it is affecting us. So I calculated my footprint based on my diet in 2018. And now that I'm having mostly 12, 13 meals a week and 40% reduction in calories, my footprint has come down by close to 75%. You may ask, if it's only 40% calorie, then the reduction in carbon footprint should also be only 40. The reason is I've moved more and more towards plant-based whole food diet. So this is a simple request for you to try to help your health and help the environment through simple, intuitive ways of living. So this is the numerous hypothesized mechanisms through which SGLT antagonists work. Same benefits may be there through beta-hydroxybutyrate. This is a study that came out of Texas, where diabetics with reduced ejection fraction, EF in the 39% range, received IV beta-hydroxybutyrate ketones. And MRI was used to measure stroke volume and cardiac output. Ejection fraction improved. And ketones can provide an additional fuel for the heart and may be used therapeutically to improve cardiac function in HFrEF. This is a very, very basic concept that cardiologists sometimes forget. The best predictor of survival in cardiac failure is actually renal dysfunction. It's more important than ejection fraction. That's what we are seeing here. GFR predicts reduction in survival more than twice, whereas ejection fraction is not that significant. Now we know step therapies and so many approaches for acute heart failure care with diuretic resistant patients. This is a patient who continued to gain weight over the last few years, and his creatinine also continued to increase in the last couple of years. And in the hospital, when he's admitted for acute heart failure with cardiorenal syndrome, through intuitive mindfulness, he is able to achieve therapeutic nutritional ketosis. And that's what I'm showing here, range of 0.3, 0.5. And what this is doing is allowing this patient without diuretics to get rid of the extra volume in his body. So we are not able to use diuretics because of acute kidney injury. Through nutritional ketosis, we are seeing excellent response, and his weight is dropping dramatically, and this time frame is about 1 week. So this I just presented at a poster session where BMI plus age, if it is 100, globally it predicts HFpEF, and if it is more than 90 in India, unfortunately the risk is higher for HFpEF. We know in acute heart failure, fluid restriction does not make a difference. We don't have to restrict salt intake and water intake, so this year we stopped doing that in our institution. Beta blockers, this is a study from Spain saying HFpEF patients will come and thank you because they're able to do more if we withdraw the beta blocker. So these are very interesting times in HFpEF. There are numerous challenges with cardiac rehab, and we know exercise is so beneficial in all cardiac patients, but I want to leave you with this thought. The heart has been optimized over the last million years. It is only the peripheral system that we are improving through exercise. Cardiac function itself is very difficult to improve because it is already optimized, especially in FF patients. So this I already presented, that younger people are more and more presenting with HFpEF due to obesity. And inflammation is something we can measure with high sensitivity C-reactive protein. And this algorithm shows through mindfulness and through fasting, we are able to achieve nutritional ketosis, improve ejection fraction, cardiac output, reduce systemic and pulmonary vascular resistance, improve pulmonary edema, acute kidney injury. In the hospitalized patients, we are able to reduce length of stay. And this is through measuring ketones every day. And this we already saw. Eating lesser helps not only obese patients, even healthy, normal, young people. If we monitor what we are eating and intuitively eat, there is so much health benefits to be achieved. It's not only physical health, but our mind becomes more, I would say, happy, optimistic, and lighter. So this is our program, and this I already presented, the 64-year-old, where we were able to reverse HFpEF just with lifestyle and our story. This is another case where patient is feeling much, much younger because his lipid profile, everything improved so much just with intuitive eating. And this lady had 20 years of HFpEF which has resolved, but more important for her is her depression of 60 years. From the age of 20, she's been having depression that has now resolved. And our weight has a lot to do with these things. In India, the excess weight is not as much as we see in the Western populations. But even here, with the range that we have, we can work with our patients to improve their cardiac health and their mindset. So now we are saying HFpEF can be reversed. Along with that, chronic metabolic issues like hyperlipidemia, hypertension, diabetes are much more amenable to lifestyle when we use these type of intuitive psychology-based and biological aging and resilience-based methods. And this is the picture of the first 4-minute mile. After this, even college students are now able to run a mile in 4 minutes. But for the first person to do that, it took so much effort. So I will conclude. Age plus BMI itself predicts HFpEF in India if it is more than 90. Fasting produces the benefits of exercise as well as SGLT antagonists, as well as close to 80 milligrams of Lasix if people can do this in the hospitalized settings. Natural ketosis may be the Siddha medicine's holy grail of eternal youth. Siddha yoga has been in India for several thousands of years. And people practicing this are known to live for over 100 years over the last several thousand years. Human life expectancy was only 40 years in the United States until about 100, 150 years ago. The last 150 years, it's not because of better balloon angioplasty or open bypass surgery. It is because of hygiene that we have seen improvement in life expectancy from 40 doubling to 80. And intuitive weight reduction reverses diastolic dysfunction, and lipid issues can also get better. Thanks so much for this opportunity.